Good morning. Good morning. Way in the back. In 1872, as many of you know, Dr. Stephen Smith and 9 colleagues founded the American Public Health Association, and of course we're very grateful to all of them today. 50 years later, at the 50th annual meeting of the association in the early 1920s, Dr. Smith returned at the age of 99 to give the principal address at that annual meeting. And indeed, he was very pleased by what he saw in the ways that the American Public Health Association had been and was continuing to contribute to public health. Had Dr. Smith and his 9 other co-founders been with us this morning, they would be astounded at the many ways in which the American Public Health Association has contributed and is continuing to contribute to improving the people's health, not only here in the United States, but throughout the world, in many ways, such as by advancing public health policy, by stimulating support for public health, public support for public health, and by improving public health practice. But Dr. Smith and the other 9 co-founders would probably be dismayed that the question asked most frequently of many of us is, what is public health? How many of you have been asked that question at least once? How many of you have been asked it 10 or more times? How many have been asked it 100 or more times? Well, I too am among you. I've been asked it literally hundreds of times. And what I say to those people is that public health is a whole series of activities that are designed to promote health, to prevent disease and injury, to prevent premature death, to assure conditions in which we can all be safe and healthy. And I tell them that many of the things in public health are invisible. You don't see them being done, but we see their results throughout the day. We all use the public health system daily, whether we use it or not. We get up in the morning, we turn on the faucet, and we know that water is safe, and that is public health. That's the result of public health. And if we're lucky, if we're fortunate, that water is also fluoridated, and that too is public health. And we go down to the breakfast table and eat a more nutritious breakfast, and there are even nutrition facts on the cereal box, and that too is public health. And we get in our cars to go to work or school or wherever we go out, and better yet, ride our bicycles. But if we get in our cars, those are safer cars, less polluting, with airbags, seat belts, child restraints, and not only are they there, but we and people across the country are more likely to use them, and all of that is public health. And we go to work, and even though our workplaces still have many hazards, and I certainly know that, but even those workplaces are a lot safer today and a lot safer than they are in many other countries, and that too is public health. And many, many other things throughout the day, our exercise patterns, many other things are the result of public health. The health care, when we have access to quality health care, comprehensive health care with not only diagnosis, treatment, and rehabilitation, but preventive services, that too is public health. And all the community-based services that are prevention-oriented, that is public health. And all the educational programs, scientific research programs, the policy work, the infrastructure that supports it all, administration, finance, and so forth, all that is public health. And most of that, by the way, I tell my friends when they ask the question, most of that is invisible. We don't see it unless there's a crisis, unless there's an outbreak of foodborne disease, E. coli in the meat, or hepatitis A virus in the desserts in the school lunch program, or unless there's an increase in diabetes, or unless there's community violence, or a flood, or a war. And then I sometimes add the Institute of Medicine definition from the Future of Public Health report approximately 10 years ago. And as many of you know, that definition is that public health is what we as a society do collectively to assure the conditions in which people can be healthy. It takes a society to practice public health. Well, my experience of people not knowing what public health was has not only been sort of confirmed by your answer today in terms of many of you being posed the same question, but the Harris poll done by the Harris organization about a year ago showed basically the same thing. The Harris organization asked a random sample of about 1,000 people across the country several questions concerning public health. In fact, they asked, what is public health? And only 3% of the population answered it correctly. In fact, that's probably all of us who work in public health across the country. They considered a right answer something like health education or health promotion or immunization. 97% of the people in that survey, 97% of a random sample of the American population did not know what public health was. Some simply said don't know. A lot of people said public health is health care for the indigent. Now, it should come as no surprise to us that our elected officials thinking the same thing. When you move all the so-called indigent people into private sector managed care programs, they believe who needs public health anymore? We've wiped out all the serious problems of the earlier part of the century. Who needs public health? And indeed, in several communities in Texas and Colorado and elsewhere across the country, health departments have even been closed before there's a large public outcry of people saying we need public health. Now, the good news from the Harris survey is this. Over 90% of the same people, when questioned, do you support communicable disease control? Do you support immunization? Over 90% said yes. When asked about clean air, clean water, control of toxic waste, over 80% said they support those efforts. When asked about safer lifestyles, and in other surveys, when asked about controlling youth access to tobacco, over 70% says yes, we support that. So there's a paradox, or you could say a huge disconnect here. 3% of the American people know what public health is, but the vast majority of people support the goals and values and even the principles of public health. Clearly, what we need to do in public health is focus a lot more of our attention on putting the public in public health. It takes a society to practice public health. As Dr. Walker said in his lovely introduction, and I thank you very much for that, Dr. Walker, as we move to the future, I want to focus my remarks this morning primarily on creating the future of public health. And indeed, the future of public health is not in a crystal ball somewhere. It's not some predetermined fate that we live into. As one of the other illustrious past presidents of this organization, Dr. Bill Foege, often says, we create the future together. We have the capabilities to create the future we want in our society and indeed throughout the world. We create the future of public health together. We need to put the public in public health, but we also need to understand some major trends that are currently occurring and will continue to occur that will profoundly impact the future of public health as we create it together, as we create it with all of society. And I'd like to briefly list these 10 trends, each of which has dangers and opportunities. Serious dangers for the health of the public, but also serious opportunities for us to improve the health of the public. The first one on my list, the first trend, are the changes in the financing and organization of healthcare. Lots of changes, and not only healthcare, but health and human services. Changes from so-called welfare reform, I know some of you call it welfare repeal, to a whole series of other changes, the for-profit conversions of community hospitals, the growth of managed care. Clearly, managed care is not evil, but it's not a panacea. But it does have many, many opportunities for public health agencies and managed care organizations and all the professional workers within them to work much more closely together to not only improve the care of the covered or enrolled populations, but to improve health of all society. At the same time, many of us are very concerned that increasingly we have a system of market-driven health care, a system in which products have become products have replaced the term services, cost containment has replaced compassion, stockholders have now replaced the term stakeholders. We should be concerned about all of that, as well as the fact that there are 40 million Americans and a growing number, about 100,000 more each month, who are uninsured. And when you go back from this meeting back to your homes and your offices, you look at your own health insurance plan, your health care delivery plan, your own health insurance policy, and see what it says. Because in addition to the 40 million uninsured, for those of us who are insured, not only is health insurance very expensive, but it's not at all comprehensive. It usually doesn't cover mental health and dental health and podiatric health and vision care and a whole list of other things. We do not have a holistic health care system in this country, and we in public health should be very concerned about that. The second trend on my list is The second trend on my list is the increasing recognition of so-called alternative and complementary health care. Over a third of the U.S. population uses products like minerals and vitamins and services like chiropractic and acupuncture on an annual basis. How many of you or your families use these services on a regular basis? A large percentage of us, a third to a half roughly. We in public health should be concerned here that these services and products be evaluated for efficacy and safety, just like products and services in more mainstream health care. At the same time, we should be building bridges to these health care providers. Many people only get their health care through these providers, and we should also have some sensitivity to traditional healers and traditional health care from which we in public health and in traditional medical and mainstream medical care really can learn a lot. So there's a lot of work to do here as well. The third area has to do with the information and communications revolution that we're all aware of. Here, too, there are dangers and opportunities. Dangers in terms of breaches of confidentiality of data, dangers in terms of depersonalization of services, but enormous opportunities to better gather and analyze and use data, enormous opportunities to better communicate among ourselves, even with public health professionals halfway around the world, and better opportunities to communicate and serve the various communities that we serve across the country and across the world. Another major trend is the biotechnology and genetics revolution that's taking place. Again, opportunities and dangers. Opportunities like the fact that biotechnology will enable us within a year or two to offer 8 childhood vaccines in one dose altogether. There are great opportunities to improve efficacy and safety of many of the things that we do. The human genetics revolution, as you know, is moving forward very quickly. By the year 2005, the Human Genome Project will be completed. We'll then know where all 80,000 or so human genes are and be well on our way to knowing what each and every one of them do. Ultimately, it's estimated that on average, each of us and everyone across the world will be determined to have 20 to 25 high-risk genetic traits. And there are important legal and ethical issues here. Do you want your government, do you want your insurance company, do you even want other family members to know your genetic code? Do you want your employer to have that information? We in public health need to get ahead of the wave. We need to be addressing the legal and ethical implications and questions that are being raised by the genetics revolution, and we need to start doing that now. The fifth trend are the incredible changes that are taking place in our population. We have an increasingly diverse population, and indeed diversity is the strength of our organization, it's the strength of our country. We need to celebrate that diversity, and we also need to make sure that all types of health services are available to all people, no matter what their language, no matter what their culture, no matter what their immigration status. At the same time, we need to prepare for the aging of the population. The age group that is the fastest growing segment in our population is 85 and older. By the middle of the next century, there'll be a million people over the age of 100, which of course means that the morning television program that celebrates birthdays of people turning 100 that day will need to run all day long. But in all seriousness, aging presents very important challenges and opportunities for us in public health. We need to make sure that more attention is paid to not only the prevention of chronic diseases and chronic injuries, we need to make sure that attention is paid to preventing the complications of those diseases once they occur, and we need to make sure that we work towards not only improving the length of life, but the quality of life as well. The sixth trend on my list has to do with changes in the economy, both in the United States and abroad. Many of the economic indicators look wonderful. Wall Street is booming. The unemployment rate is low. But indeed, most people are working longer hours. The average work week now is 47 hours. It was 41 hours a decade ago. We're certainly not living in the era of leisure that was anticipated. And many people, indeed many parents, are working 2 or more jobs, which has profound impacts for children's care. There's more and more latchkey children. There are more and more childhood public health problems as a result of the phenomenon that everybody is working and seemingly working all the time. We also should be concerned what's happening with the globalization of the economy. Yes, the gross national product is growing quickly in a number of so-called newly industrializing countries, but indeed many countries, Mexico being the nearest of them, are so desperate for economic development, and so many people in these countries are so desperate for jobs that they're willing to take jobs with unfair labor practices and serious health and safety problems in the job. We should be concerned about this. The sweatshops, the environmental pollution, the child labor, and indeed the export of hazard. Not that long ago, 2 American companies exported a pesticide that was known to cause sterility in men. They exported it after it was banned in the United States. They exported it to a bunch of mainly developing countries, and there are well over 25,000 men in those countries who are either sterile or have reduced fertility as a result of that export of hazard. But export of hazard goes on all the time. Tobacco, unsafe drugs, unsafe pesticides. We in this country need to do something about that. The 7th trend has to do with the changing role in government, and there's some positive things and some negative things going on. It's interesting that there seems to be a lot of government bashing, but in that same Harris poll, 3 out of every 5 people questioned support the fact that government should be taking the lead in moving public health forward. By the way, we in public health always look for the empty half of the glass, and there's some of you out there who are saying, well, 2/5 of the American public want somebody else to do the job. If this were election night and somebody got 60% or so of the vote, we would call that a landslide, right? So there's a landslide of people out there who want government, and of course not only government, but other institutions, educational institutions, institutions in the non-governmental sector, the for-profit, the private sector, and other parts of our society to participate in joint efforts to improve public health. Indeed, some of the people who most complain about government and government being too big and too many people working for government, those are the first people to ask for government services, and I know the folks in Minnesota and North Dakota are among you, when there's a flood or some other catastrophe or a foodborne outbreak or some other need for public health. Those are among the first people to ask for those services. The 8th trend that I want to point out has to do with happening to the fabric of our society, our non-governmental civic organizations. These organizations, whether you know it or not, are in serious decline. Not every single one of them, but on average, there's 1/3 less participation in these organizations than there was 3 decades ago. These are the organizations not only where we get out our public health message, this is where we engage the public in the work of public health. This is where we engage people in the public health issues that affect or may affect them or their families or their communities. We should be concerned about what's happening in these organizations and work towards strengthening them. One of the very positive developments in recent years has been the creation of our Faith Community Caucus with the leadership of Dr. Cass Evans, and that's an important step in rallying behind these organizations and building bridges with them for better public health. The 9th trend on my list has to do with the deterioration in our social cultural environments. Throughout our society, indeed throughout the world, there's a weakening of these environments. I grew up in Bayonne, New Jersey, and I had 20 first-degree relatives within 6 blocks of where I lived. How many others of you grew up in a similar situation? Well, now my parents are the only ones who live there. Everyone else has died or spread out across the country, and while we email one another occasionally and see each other from time to time and write letters and so forth, it's not quite the same. Our social cultural environments, our families, our neighborhoods, our communities support the very healthy attitudes and behaviors that we most want to promote. We need to be concerned about this, not only here in this country, but across the world. It's typical in many countries for young men to leave their families behind in the countryside, to leave the women behind with the physical and social and psychological burdens of raising the family and so forth, and providing some livelihood for the family, while the men go to the city seeking jobs, often facing serious public health risks, whether they get those jobs or not. Problems like alcoholism and drug abuse and sexually transmitted diseases, including HIV/AIDS. We need to be concerned about bolstering and strengthening our social cultural environments, not only here in the United States, but throughout the world. The 10th trend on my list is what I call a crisis of values. It seems to me that there's more and more apathy in our population about issues of social justice. We should be very concerned about this. It seems that we spend a trivial amount of our resources, both here in this country and throughout the world, for the poor. The author Marianne Williamson says we've actually created a system that comforts the comfortable and afflicts the afflicted. Instead of having a war on poverty, we seem to be having a war against the poor, and this can't go on. The gap between the rich and the poor is the largest it's been in 70 years in this country. The gap between the rich and the poor has doubled in the last 30 years when we look globally at this issue. Hubert Humphrey, the late Hubert Humphrey, senator from Minnesota, used to say that the true measure of any civilization is how we treat people who are young and old and who are physically and mentally disabled. We need to look at this measure of how our society, how our civilization is faring up, and use that as a way to point out what needs to be done in public health. So these are the 10 trends that I'm concerned about. I think all of us not only should be concerned about, but we need to really understand these trends to get ahead of the wave, and not only to react to things, but to proactively create opportunities to improve the public health. Well, what do we need to do? I think the theme of this meeting, communicating public health, gives us several clues, and I know many of you, of course, know what to do. But I think the first thing in communication is listening. We need to listen to the people and the communities that we serve. We need to listen to what's needed and wanted. We need to understand people's perception of health and of public health and what their role is in it and what our role in that may be. Secondly, we need to educate and inform in many, many different ways. I believe that an educated society will ultimately make the right decisions, and indeed it does take a society to practice public health. We need to educate and inform both directly to people where they work, where they live, where they play, in their communities, in their homes, but we also need to work more effectively through the media and take advantage of so-called teachable moments. Many of us are familiar with the fact that when parents have a newborn infant, there's a teachable or educational moment there to talk about seatbelts and a whole range of preventive measures for good child care and so forth. At the same time, societally, there are teachable moments. When I was at the Hawaii Public Health Association meeting last year, I learned that the public health professionals in Hawaii did a very smart thing. Mad cow disease was on the front page of the newspaper, and when the reporters called up, they said, you know, we don't have mad cow disease here, but by the way, before you hang up, you'd be interested to learn that multiply resistant TB, also infectious disease, is increasing here in Hawaii, and so is HIV/AIDS and other bacteria and viruses and parasites. And you should also know that the state legislature is about to reinvent and downsize disease control activities in the state health department, privatize the state laboratory, and they're about to close the School of Public Health. Now, that's what I call a teachable moment, and taking good advantage of it. We also need to advocate and to teach ourselves and others how to advocate more effectively. One of our award winners 2 years ago said, "You people in public health are much too shy." We need to assert ourselves a lot more, not only at the federal level, but increasingly at the state and local level, and not only advocating for sound, specific public health policies and programs, but we need to remind ourselves and the policymakers and the public at large that we need to support the overall infrastructure of public health. The research institutions, the educational institutions, the agencies, particularly at the state and local level. We need to support the entire infrastructure and make sure that it's responsive to community needs. And finally, in addition to listening to people and educating, informing, and advocating, we need to develop partnerships. That's so critical in the work that we do. Partnerships not only with like-minded public health and health-related organizations, but we need to reach out to all groups in society. And I can give many examples from the wonderful things I've seen going across the country in this past year. One of them is that in the state of Washington, when they developed their statewide public health plan, they have over 500 community groups and other other kinds of agencies and organizations, not only giving input into the development of the plan, but also into its implementation. They've essentially bought into the plan. They really believe in the state of Washington, and I know many other places across the country, that it takes a society to practice public health, and they indeed are putting the public in public health. A different kind of example, though, comes from New Mexico, where when I was there, I saw that around issues of gun safety, the public health professionals in New Mexico have even found common ground with the National Rifle Association on issues of educating parents and children about gun safety. I maintain that whatever our differences are with other groups, we can always at least find some common ground for the good of society. It takes a society to practice public health, and we can't write anybody off. So in addition to thinking about what we need to do, we also need to answer a question that we usually don't consider, and that's the question, who do we need to be? We need to think of values, vision, and leadership. You know, values are the things that probably best define us as a group. They're the things that brought us into public health in the first place. It's the things that ultimately we often feel most passionate about. Values, general values like respect for human dignity, and certainly respect for health and well-being and quality of life. Values like social justice. Values like community responsibility. We indeed are our sisters and brothers' keepers. We need to support these general values and also specific values like environmental justice and a woman's right to choose. Dr. John Hertie was president of this association 85 years ago in 1912. He was the Secretary for Health, the Commissioner of Health here in Indiana. And in his presidential address in 1912, he said that prevention is undervalued. He became a champion for prevention, and indeed there are many champions of prevention among you right here in the audience, hopefully all of you being champions for prevention. We not only, like John Hertie, need to be champions for prevention, we need to be champions for social justice. We need to make sure not only that everybody has a slice of the pie, we need to make sure that everybody has access to the kitchen. And we need to have visions of healthy and safe lives and healthy and safe communities, even impossible visions. Robert Kennedy used to say often, some people see things as they are and ask why. I see things that never were and ask why not. I dream, why not? We need to ask why not. We need to dream of things that never were and ask why not, even visions that may seem impossible. If it were not for impossible seeming visions of people 25 years ago, we would not have the progressive smoking policies that we have today. We would probably not be in a smoke-free facility. Were it not for the visions, the impossible visions of people 50 years ago, we would not be on the brink of worldwide polio eradication today, were it not for those visions. And were it not for visions of people many years before, we would not have the American Public Health Association or the many other health-related organizations, including our state and local public health associations, doing the work that we're all doing around the country. We need to have visions, even impossible-seeming visions. The philosopher Soren Kierkegaard once said, "Life can only be understood backwards, but it must be lived forwards. And to do so effectively, we must have visions, even impossible visions, and the courage and persistence to see those visions come to reality." And finally, we need to have leadership to translate these values and visions into actual programs and policies. We need to have leaders who not only do things right, but choose to do the right things. We need to demonstrate by not only what we say, but what we do, what public health is all about. We need to not only be leaders ourselves, we need to call forth leaders in all the other people that we deal with in public health. Gandhi used to say, "Be the change that you want to see in the world." We indeed need to be the change that we want to see in About a year ago, a visiting professor from England came to visit us at Tufts Medical School, where I have an adjunct appointment. And I was saying to him, I said, we in public health are fighting to get a seat at the managed care table. And he said, we in England consider ourselves the table. And I thought that was kind of an arrogant remark. I mean, who's the table? But I now see the wisdom of his remark, because indeed we in public health do need to be the table, not only around issues of managed care, but many issues. Indeed, society gives us the mandate to be the table, to gather the data, to go out and listen to people, to gather the data, to frame the issues, to pose the questions, and to bring everyone, or their representatives at least, around the table, our table. We need to figuratively be the table and exert that kind of leadership. And we need to have leaders who not necessarily are out there looking for credit for what they've done, but leaders who know that when they've accomplished what they set out to do, their acknowledgement is seeing the fruition of their visions and their values. There's a wonderful poem from the Chinese tradition that goes like this, and it really encompasses a lot of these qualities of leadership. And it goes, go to the people, learn from them, love them. Start with what they know, build on what they have, but are the best leaders when their task is accomplished, their work is done. The people will remark, we have done it ourselves. That's the kind of leadership we need to call forward. Now, you may ask, where are these people who are going to generate these visions and have these values and provide this kind of leadership? Of course, they are the people sitting in your chairs and your colleagues across the country. You are the leaders of public health. All of us together need to exhibit these values and visions and leadership if we really want to have public health. You might ask, well, maybe this is not the right time. Maybe we should wait a few more years. But in fact, if not you, who? If not now, when? We need to exhibit this leadership, and we need to do it now. So as we move forward and create the future of public health and create it together, let us remember these visions, even impossible visions, for healthy and safe lives and healthy and safe communities. Let us remember the values that brought us into public health in the first place, and not be afraid to articulate them, even in unfavorable political climates, to articulate them with passion and with courage and with persistence. And let us be the leaders of public health, leaders to shape the future of public health. And let us not forget that it takes a society to practice public health, and that we need to put the public in public health. Thank you very much. Thank you. Thank you very much.